Welcome back. March is Colorectal Cancer Awareness Month. Now, according to the CDC, colorectal cancer is the second leading cause of cancer deaths in the U.S. I spoke with Chief Medical Officer for Medicaid Dr. Diana Weber. She's from Blue Cross Blue Shield of New Mexico, talking about risk factors, symptoms, and screening guidelines for colon cancer and how you can reduce your risk of getting it. Dr. Diana Weber is joining us this morning. She is with Blue Cross Blue Shield of New Mexico. Dr. Weber, great to have you with us.
Thank you. Thanks for inviting me.
Definitely. So the subject of the morning that we're going to be focusing on right here is colorectal cancer. For the viewers at home, let's explain what that is.
So colon cancer develops in the large intestine, which includes the colon and the rectum. And it's usually a very small growth that starts on the inner lining of the colon. It starts often as a polyp, but not all polyps are cancerous or can become cancer, but a polyp can develop into a cancer, which is why we want to remove polyps when we detect them before they can develop into cancer.
Yeah. How important are the checkups? That as you get older, or a person gets older, that they have these kind of exams done. How important is it to discover this early enough?
Oh, it's very important. First of all, by the time you get any symptoms of colon cancer, it's beyond, it's a little bit advanced. It's still treatable, but we want to detect colon cancer before you have any symptoms. So that's why we recommend screening. We recommend screening everybody starting at age 50 with a screening colonoscopy. Actually, there are some now some recommendations recommending starting even earlier, as young as 45, especially for African Americans. So we recommend everybody get screening between the ages of 50 and 75. Because if a polyp is detected at that point, it can be removed before it has a chance to develop into cancer. So colonoscopy is the gold standard.
Well, let's talk about some of the risk factors that could potentially lead a person to having it. I mean, I'm assuming family history would be prevalent as well.
Oh, yes. This family history is a big risk factor. There are also some genetic abnormalities that you can inherit from your family that even are more risky. Of course, as we age, our risk for cancer increases. And then there's some inflammatory conditions that also increase your risk. And there are some behavioral things that increase your risk. So a diet high in red meat and processed foods, drinking too much alcohol, smoking, not exercising, all of the things that kind of put you at risk for other diseases as well.
Wow. So right now, there's been leaps and bounds in progress of how it's been able to be detected, and like you said, treatment. Let's talk about some of those advancements that's been happening over the years.
Well, there is something called virtual colonoscopy, which we don't, it's not the gold standard of colonoscopy, but that is one option. There's some other non-invasive tests for detection. Again, not as good as a screening colonoscopy. Colonoscopies have gotten much better. It's very well tolerated. People have a lot of fear about the process itself or the prep, but it's actually very well tolerated. And the good news is that we now know that if you have a completely clean colonoscopy at age 50, no polyps or anything, you don't need another one until age 60. You get to go 10 years. And there's advances in treatment as well. We can treat colon cancer with less invasive surgery. And there are, of course, when it's more advanced, there are other chemotherapy regimens and things like that. But what we really want to do is catch it early, so it's just a matter of surgically removing it and letting you get on with your life.
And again, being aware of possible symptoms as well, correct?
Yes. So symptoms, again, when you have symptoms, you definitely want to see your doctor, but you don't want to wait till you have symptoms. So symptoms are bleeding in the rectum, blood in your stool, weakness, fatigue, unexpected weight loss, and a persistent change in bowel habits, such as persistent diarrhea or constipation.
Dr. Weber, where can we go to find more information about all this?
I recommend the American Cancer Society webpage, which is simply cancer.org.
Great. This is very, very valuable information, and again, something to be on the lookout for and to make sure you get those screenings done early enough. Dr. Diana Weber, thank you again for joining us. We appreciate it.
Thank you so much.